All children who are eligible for CHDP are also eligible for WIC. For this reason, all CHDP clients under 5 years of age should be referred to the WIC program. The PM160 can be used as a referral and documentation of height, weight, and hemoglobin or hematocrit result, which are required for the WIC application. Below the tobacco questions and WIC referral boxes are the boxes for partial screenings. Partial screenings are done when a patient requires a component of an exam but may not be due for a complete exam. Sometimes when a partial screen may be necessary are when a child needs to be brought up to date on immunizations, if they need a hemoglobin or hematocrit reading for WIC, or if you are doing screening procedures that were not done during a previous exam. Never use a partial screen to recheck a child who had a problem identified in the history and physical exam section. There must be a written explanation for a partial screen written in the comments problems section. Screening procedure rechecks are done when the accuracy of a procedure's results are questionable or failed. For example, if you are unable to obtain an accurate Snellen result because the child was misbehaving, then you will reschedule the appointment. On the PM160 for the second appointment, you will check the screening procedure recheck box and write the date of the previous exam. The screening procedure recheck is only to be used for tests that were coded to questionable result recheck scheduled. Now that the exam portion of the visit is done, you will fill in the fees, using the schedule of maximum allowances. Remember, you should only bill for those tests and assessments delivered in the office, such as the administration fee for immunizations, or collection fees for lab tests. Now you can enter your clinic's name, address, phone number, Medi-Cal CHDP provider number, signature, and date on all 4 copies of the PM160. The date by the signature must match the date of services. We are now done filling out the PM160. You need to send the copies to the appropriate places. Green envelopes are used to mail the top copy of the PM160 to the state for payment. The yellow copy should be sent to your local CHDP office once a month, even if you are billing electronically. The white copy of the PM160 will stay in the chart, and the pink copy of the PM160 should be given to the responsible adult. You can give the parent this copy without the fees on it if you would like, but they must receive the pink copy. Not only is this an excellent method of communicating the results of the exam with the responsible adult, but it is a declaration of the parent's acknowledgement that the information will be shared with the CHDP program. When you need more PM160s, you can order them through your local CHDP office. If you have not received them within 4 to 6 weeks, you can call the CHDP office to track your order. When filling out the order form, please make sure to complete the name, address, and provider number exactly as Xerox has documented for your CHDP provider enrollment data. There have been some significant changes to the periodicity schedule. Tuberculosis testing is no longer routine for all patients. Perform this screening only when the tuberculosis risk assessment deems it necessary. The urine test is also no longer routine and should only be performed when clinically indicated. As always, make sure to explain all of this in the comments problem section. You will now have an opportunity to practice filling out a PM160. Before you begin, you will need to gather 2 blank PM160s or 2 copies of a blank PM160, a pen or a pencil, a copy of the schedule of maximum reimbursement rates, and a periodicity schedule. Directions. Fill out your PM160s to the best of your ability. You can pause or rewind the video as needed to gather all necessary information. You should correct sample number 1 before moving on to sample 2. Jane is a female Caucasian. This is her first visit to your clinic. However, she has had a CHDP health assessment at another clinic 7 months ago. You welcome Jane and her mother, Mary Doe, into your clinic, and you gather the following information by verifying her CHDP eligibility. She was born August 16, 2011. Her address is 1234 B Baker Street, Long Beach, California. Her phone number is area code 123-456-7890. Her aid code is 8W, and her BIC is 01-23456-7890-123. You measured Jane's height to be 32 3/4 of an inch, and her weight as 33 pounds and 0 ounces. You recognize that this puts her with having an obese BMI, and you offer nutrition counseling to Mary. You also encourage her to bring Jane back in 3 months for a weight check-in. While counseling, you also review the dangers of tobacco use. Mary responds that nobody in the family uses tobacco of any kind. You proceed to perform all necessary screenings according to the periodicity schedule, and all tests come back normal. Jane's Snellen result is as follows: right eye 20/20, left eye 20/20, both eyes 20/20. Her audiometric screening result is within normal limits. Jane is at high risk for tuberculosis, so you administer a Mentos. Because Jane is under 5 years of age, you also measure her hematocrit and her hemoglobin. Your clinic does perform venous lead tests, so you test Jane since she is 2 years old. You also offer general education about the dangers of lead poisoning in children Jane's age. When you look at Jane's immunization records, you see that she's already up to date for hepatitis A. However, Mary requests a flu shot for her daughter. 24 hours after this exam, Jane comes back for you to read her TB test. It comes back at 0 millimeters of induration. Finish filling out your PM160. If you need more time, press pause now and finish filling out Sample 1. A few reminders. Make sure to use block lettering, putting 1 letter per letter box while filling out the PM160. Refer to the schedule of maximum allowances and the periodicity schedule while filling out the PM160. Your patient information section should look something like this. Remember to add 12 months to the current date in order to get the next CHDP exam date. Enter the day, the month, and the year, since the patient is under 2 years of age. The middle of your PM160 should look something like this. Remember to use the fees from the maximum reimbursement rate. Don't forget to write in the aid code from the printout and the patient's benefits identification number. This section is where you will enter your clinic's information and signature. Don't forget to write your provider number. John is a male Hispanic. This is his first visit to your clinic. However, he has had a CHDP health assessment at another clinic 2 years ago. You welcome John and his mother, Maria Garcia, who speaks only Spanish, into your clinic. Maria tells you that John is not on Medi-Cal. She reads and signs the eligibility statement, which you staple to the PM160. Maria then gives you the following information. John's birth date is May 6, 2008. He and Maria live at 112 Main Street, apartment number 5, in Long Beach. Their phone number is 562-444-3333. After entering the information from the DHS 4073, you write in the aid code 8W and the CIN 24681012141618. You measure John's height to be 45 3/4 of an inch and his weight at 50 pounds and 8 ounces, His blood pressure is 100/60. While you are taking his measurements, Maria tells you that John has had asthma since he was young. You review the dangers of tobacco and its effects on asthma. Maria responds that nobody in the family uses tobacco of any kind. You proceed to perform all necessary screenings according to the periodicity schedule. The results are as follows. You notice Class 3 dental caries, and you refer John to Dr. Tooth at 562-424-5555. While attempting the Snellen and audiometric screening, John is restless. You're able to gather a Snellen result of 20/20 in his right eye, 20/30 in his left eye, and 20/40 with both eyes. But you would like to reschedule both screenings just to make sure. His hemoglobin comes out to 9.2, which is anemic, so you provide nutritional counseling, specifying foods high in iron. John's developmental assessment, as well as his urine dipstick test, is normal. John is at high risk for tuberculosis, so you administer a Manteau. 24 hours later, you read the result as 20 millimeters of induration. Due to the positive tuberculosis result, you refer John and his mother to the Long Beach Comprehensive Health Center at 562-599-2153. When you look at John's immunization records, you see that he is already up to date for HPV and varicella. However, he requires boosters for DTaP, IPV, MMR, and HAV. You administer these vaccines, bringing him up to date on all immunizations. If you need more time to finish filling out the PM160, please press pause now. Some reminders. Follow-up codes are used in columns C and D. Remember to write an explanation in the comments or problems section anytime you use a follow-up code. Refer to the VFC vaccine codes while filling out the PM160. Make sure the code matches the vaccine, as some similar vaccines have different codes. Your patient information section should look similar to this. The middle of your PM160 should look similar to this. Make sure to fill out the referred to boxes with the name of the provider and the contact telephone number. Please note that the routine referral dental box is not checked. John's presentation of dental caries means that this referral is not routine. Also make sure to document that John's mom is Spanish speaking. Since John is over 5 years of age, you do not need to fill in the WIC referral boxes. You do need to write down the aid code and the identification number from the printout, and document that this patient is eligible for CHDP benefits only. Finally, you will enter your clinic's name, address, and signature. Thank you for taking the time to view this training. If you have any comments or questions, please contact Morgan Venter, CHDP Health Educator at the Long Beach Department of Health and Human Services.